I open this debate today with a simple but urgent truth. Wales is facing a health emergency, and it is time that the Welsh Labour government finally admitted it. The NHS in Wales is in the worst state it has ever been. Today, nearly 1 in 5 people in Wales are waiting for treatment. Almost 800,000 patient pathways are open, and over 250,000 people have been waiting for more than 9 months for care. Thousands are still waiting over 2 years, something that has been almost eradicated in England. And if that's not an emergency, I do not know what is. Labour will tell us about their 120 million fund to cut waiting lists. They will tell us about Wales becoming a marmot nation. But patients in Brecon, Bridgend and in Blaenau Gwent don't need hashtags or slogans. They need treatment and they need it now. We have the worst A&E waiting times in the United Kingdom. In April, just 67% of patients in A&E were seen within 4 hours here in Wales. While in England, the figures, despite challenges, are consistently better across the board. Every month, over 100,000 people in Wales wait more than 12 hours in A&E. While they wait, ambulances queue outside, unable to offload patients, tying up paramedics who should be on the road saving lives. The Welsh Ambulance Service has not hit its target for 8-minute response times for life-threatening calls for 4 years straight. And it is reaching fewer than half of those calls within the time. Deputy Presiding Officer, let us remember the human reality. In Bridgend, an 84-year-old grandmother waited 30 hours for an ambulance after breaking her hip. In another case, a patient lay on the floor for 46 hours waiting for help. And a coroner in Wales has said that patients are dying because ambulance delays. If that's not an emergency, Cabinet Secretary, I don't know what is. But the crisis does not stop at the hospital doors. GP services in Wales are overwhelmed. We have nearly lost 20% of our GP practices in a decade. And we now have over 2,200 patients per GP in Wales, double the European average. Is it no wonder why people give up trying to get a GP appointment and end up in A&E, just adding to the pressure in our emergency departments? NHS dentistry in Wales is collapsing. 1 in 3 people cannot find an NHS dentist, and many parents are forced to drive their children to England for dental care. I've heard from constituents in my own part who are using the shop-built filling kits for their teeth because they live in pain daily and they just cannot get a dentist appointment. One of my constituents even decided to rip up their tooth with the pliers because they couldn't get an NHS appointment. It is absolutely shocking. Mental health services are also in crisis. Children in Wales have waited up to 99 weeks for a follow-up appointment with CAMHS. One young person from Cardiff waited 14 months for just an initial assessment. These are not just delays, they're not just numbers, they are the lives of people that are being put at risk. Labour will say that they are tackling health inequalities, but how can you tackle inequalities if you cannot get people the treatment that they need in time? Yeah, I'm sure the Cabinet Secretary will point to the Marmot Nation plan, but I think this has become a distraction from the immediate crisis facing our health service here in Wales. As I said, they'll point to the 122 million waiting list fund, but none of that money has been allocated to cross-border care. Spending of 1.5 billion on health since 2021 by the Welsh Government, and waiting lists are still at record highs. That money is not delivering for patients, and we don't have a clear plan of how it's going to get any better. And while this demand for care has risen, the Labour government has cut more than 4,000 hospital beds since devolution. And it's also closed community hospitals right the way across Wales. And if you listen to the previous First Minister, he believes we need to go further, cutting more beds and cutting more hospitals, removing that local capacity that communities really rely upon. Now that we see the consequences, don't we? Hospitals running at full, elective surgeries cancelled, ambulances unable to offload, and patients waiting in corridor with a crisis in corridor care that's becoming the norm. Deputy Presiding Officer, we cannot fix this if we will not face it. Our NHS needs a clear recovery plan with accountability, not slogans. It needs a proper workforce plan to recruit and retain staff across Wales, and that needs to happen in every community. But it also needs investment in social care. so that patients can be discharged safely, freeing up hospital beds and reducing ambulance delays. And it needs the political will in here to cut waste across our NHS and focus every single pound on delivering for patients. Declaring a health emergency is not about headlines. It's about honesty and it's about urgency. And it's about doing what is right. It's about telling that mother who has waited 3 years for surgery that we see you and we'll act. It's about telling the paramedic that spent 12 hours outside A&E with a patient that help is coming. And it's about telling that young person who's waiting for mental health support that they will not be forgotten by the system. Labour has been in charge of our NHS in Wales for 26 years. They've had every opportunity to plan, to deliver and protect our health service. Yes, what have we seen today is a system on its knees, patients suffering and staff exhausted. Many people say, let's try something different. Let's look to other political parties to solve the problem. But that isn't going to work either, because under them, the NHS simply will not exist, replaced by a French-style insurance-based system, which will mean people paying up front, having higher costs, and some people not even getting insurance altogether, suffering in pain while our NHS gets dismembered. And that is not something I want and not something the Conservative Party will ever subscribe to. If it is not time today, then, to declare a health emergency, when is? Deputy Presiding Officer, we owe it to the people of Wales to be honest about the state of our health service. We owe it to them to act. We owe it to them to protect our NHS, protect lives. Because if we cannot do that, and if we deny the scale of the crisis, people will die and suffer unnecessarily. So that's why I urge all members across this chamber today to support this motion. Let us declare a health emergency in Wales and let us begin the hard and necessary work of putting our NHS back on the right foot to deliver for taxpayers who pay for it and to deliver for the patients who need it. Diolch fawr iawn.
I have selected the amendment to the motion and I call on the Cabinet Secretary for Health and Social Care to move Amendment 1, tabled in the name of Jeremy Miles, formally.
Thank you.